So while we continue to practice CDC guidelines, nearly 4 weeks of social isolation can be difficult for adults, let alone children. Child psychologist for the Institute of Living at Hartford Hospital, Dr. Saunders joins us. Doctor, thank you for being here.
Thank you for having me.
So, Doctor, what's going through the heads of our little ones right now?
So I think actually they're starting to adjust to a little bit more of a different routine or change in expectations. At first it was very novel and I think very confusing, but about 4 weeks in now I think they're starting to get into a more of a routine. That doesn't mean it's still not disconcerting at times, but I think kids are starting to get a little bit more used to it.
Sure. So I have to tell you, my 2-year-old started crying the other day that she missed her grandmother. How do you explain this to toddlers and children?
Well, we always take a developmental approach. So for younger kids, we're going to use very simple explanations, and it is hard. It is confusing. You want to stay as much in the here and now, but younger kids don't really understand, and you just have to use kind of phrases like, for now, we can't visit with our grandparents or visit with our, our elderly neighbors who we're friends with, but we will at some point in the future.
Sure. And what other emotions are you seeing from your patients?
I would say for the most part there's a level of anxiety and uncertainty, and really the theme that we're trying to promote is tolerating uncertainty. There's a lot of uncertainty for not just the adults but certainly for the kids as well. So as much as we can to help ride the wave of some of those negative emotions, the expression is move a muscle, change a mood. So ride the wave of the negative emotion, help them get through it, find a little bit of structure and something to do. Often kids do well with suggestions or choices, giving a couple choices. But this is a difficult time, and it's okay to acknowledge this is a difficult time.
Sure. And how do we bring kind of the normal back into our children? I'm assuming sticking to the routines you had previously?
Well, yes. What's normal is no longer even existing. It's finding that new normal, that new typical. For the most part, it's having some type of routine and some structure, but not making it overly rigid and not putting too much pressure on the parents or on the kids. Having a routine, getting up, doing the things that you typically do, having some time for schoolwork, but also setting up times for breaks is okay also.
Sure. And Doctor, are there any specific behaviors parents should be looking for if their child is struggling at this time?
I do worry about kids who are more vulnerable, who might be prone to be more hyperactive or more anxious or more depressed. So parents know their kids well, and to keep an eye on those things that would be more problematic, or if you see a drastic change in their behavior, there are resources out there as part of the Hartford Healthcare Behavioral Network and the other behavioral networks to reach out for resources if you think your child's really struggling. Schools are also great resources because their school counseling departments are still available.
Sure. And when this is all over and kids go back to school, how can parents help their child resume those everyday activities and routines?
I think that kids are going to be thrilled when they get to return back to some of the routines. I've heard many kids say they can't wait to go back to school because that's where they make, not just that's their routine, but that's their connection, their social connection. We are social beings. We need those connections with other people. I've started changing the term. Instead of social distancing, I'm talking about physical distancing and trying to find a way to have emotional connections. But I think kids are going to be thrilled when they get to go back to school.
Sure, I think parents might be as well. Dr. Saunders, thank you so much for your time
absolutely.
And the information.
Oh, won't that be
Thank
great?
you.
All right, Lisa.
All right.